Thank you for staying with us on the news at 1. Experts have identified the importance of proper care of the eyes and clear vision in enhancing safety on the roads and reducing the number of road crashes. Senior reporter Kazim Olowe has more details.
It has been confirmed that many road crashes occur due to poor vision, and this can be reduced if proper attention is given to the eyes by drivers, especially those in the transportation business. This was made known by eye care experts during the free eye screening and treatment organized by the Road Transport Employers Association of Nigeria in Ogun State. More than 100 members of the association benefited from the exercise. The experts want drivers to take good care of their eyes and want those with eye problems not to drive at night.
The thing that we really observe among these drivers is that there are many eye problems that if they didn't check their eyes, they won't get it. But the only thing we observe most is that most of them are refractive error. And then secondly, almost all of them, they have something they call pterygium. Maybe due to their exposure to sun and dust. So I want them, number one, to continue this processing by checking their eye at least once in a year.
Speaking on the significance of the program, the Secretary of the Union in Ogun State says the leadership is concerned about the safety and well-being of members and other road users in the state.
I've done it before. The last time we did this type of free eye screening for our members, we discovered glaucoma and some other sight problem, and which the state headquarters paid the bills for those that need surgeries. And those that need eyeglasses, with the help of the eyeglasses, it corrected their sight.
This initiative is a very welcome one because it's not idea of giving drugs or giving glasses alone. It has to be preceded by the eye screening, whereby people are being screened to know the exact position of their sight, and it's a very welcome idea.
All the leaders of the union in attendance emphasized the need to care for the body and eyes and admonished members to always put safety first while driving. Kazim Olowe, TVC News, Abeokuta.
Away from that, experts in the humanitarian sector are seeking ways to design interventions for improving the health and livelihood outcomes for women and girls in Nigeria. Now, they believe this can be done through addressing the harmful gender norms that create barriers to promoting their health and economic benefit. This formed discussions at the National Dissemination of a Gender and Social Norms Research Study in Abuja. TVC News' Kemi Balogun reports.
Several factors contribute to and negatively impact the health and livelihoods of women and girls in Nigeria. Without proper methods to reversing the negative trends, many of them do not achieve their full potential in life. As part of efforts to change this narrative, a research study was conducted to highlight not only the challenges they face, but to also design interventions that will be tailored to their specific needs.
This kind of notion that when you uplift a woman, you're certainly taking her to a position where she would now lord over a man or lord over a man, and be disrespectful and hope. So the respect is earned. It is not in such a way. What we are advocating for are the independence of women. Women are very much at the lower point of the ladder. So bringing up women to be more financially independent, to be able to cater for the house and also provide financially in the household.
You see certain cases of women-led households because either the men have left or the men have been killed or something, and then the burden of a woman leading the house, now the burden of men leadership of the household has shifted to women. So those peculiarities is what studies like this help us bring out, and it helps us to design better interventions.
The study will be used to address the negative social norms that act as barriers to improved health and livelihood outcomes for women and girls by understanding the shifts in household dynamics as well as the drivers of the challenges in order to create accurate policy framework.
For instance, the impact of the current economic climate and how that has created certain shock on communities, and communities actually have to adjust. And therefore, in that adjustment process, new norms are emerging, and some of those new norms are really positive norms, and therefore the challenge will now be, how do you design programs and intervention to sustain these new norms?
This high-level gathering agrees that collaborative strategies for dismantling harmful gender norms that create barriers to promoting health and economic advancement for women and girls need to be addressed. Kemi Balogun, TVC News, Abuja.
Well, outside Nigeria, South Korea's prosecutors have indicted impeached President Yoon Suk-yeol on charges of leading an insurrection with his short-lived imposition of martial law on the 3rd of December. Insurrection is one of the few criminal charges from which a South Korean president does not have immunity. It is punishable by life imprisonment or death, although South Korea has not executed anyone in decades. Anti-corruption investigators last week also recommended charging the jailed president, who was impeached by parliament and suspended from his duties over the incident. Mr. Yoon's lawyers had urged the prosecutors to immediately release him from what they called illegal custody. President Yoon and his lawyers argued at the Constitutional Court hearing last week in his impeachment trial that he never intended to fully impose martial law, but had only meant the measures as a warning to break political deadlock.